What do you say to a mother who's pregnant today, who's concerned about taking Tylenol in their pregnancy?
So actually, that's a very important question for two reasons. First of all, it's for safety of the mom. And secondly, because it highlights how science works.
Right.
So first of all, we have last week a large analysis of all previous studies came out to show no association, right? So in general, we can say the evidence for association is extremely weak to non-existent. But secondly, that's not how we make scientific decisions about what recommendations to make to a clinical population. Right. To Steve's previous point, we balance risk to benefit. So I will say Tylenol does not cause autism. I can clearly say that, just put it to rest. Yeah. But pretend that there was a tiny increase of risk from Tylenol, okay? There is... Okay. There is also risk to leave moms untreated. So we know, for example, leaving infections and high fever untreated in pregnancy has both sequelae for both the baby and for the mother. We know that leaving chronic pain untreated affects the mental health of the mother, but actually affects the baby. Right. So we are balancing risks when we actually make recommendations. So we would still say that autism is the safest option we have for pregnancy, safer than non-treating. Okay. Because not treating has risks. Right? So it is about it's about the balance of risk. And so just saying something causes something or it may increase tiny the risk of something is not enough to make a clinical recommendation. You also need to know what is the risk of not treating and then balance it out, right? Yeah. So I would say, based on the systematic review that came out last week, that put all the data together, we have no evidence that Tylenol causes autism. Okay. But even if we find something, like we are in that situation sometimes, like anti-epileptic medications for depression, where we have a little bit of evidence that they may slightly increase the risk of neurodevelopmental conditions, we still most of the time choose to treat. Right. Because the risk of not treating is worse. Right. And I want to say one more thing about this. Babies are not the only things that matter.
Yes.
Moms matter too, right? So this idea that we're going to leave pain and infections and treat it in the moms is something we should reckon culturally with. Yes. What does it mean to say that to avoid a tiny increase in a risk sacrifices the well-being of the mothers, right? There is something there we got wrong. Yep. We all matter. Right. Moms matter, dads matter, kids matter. We all matter. It's a balance of risk to ultimately support a good life for kids and parents and families, right? But just to put this one to rest, Tylenol does not cause autism.
Right.
It's also important to point out that this was the worst example of how autism, sort of science should play out in not just recent history, in history.